next presentation is by Dr. Waleed El-Nahas. Dr. Waleed is a surgical pathology resident at Maadi Military Hospital, and it is entitled A Pretty Looking Spotted Tumor, and it's under supervision of Dr. Zahra El-Alfi. Dr. Zahra, researcher of pathology at National Research Center, Cairo, Egypt.
Hello everyone, I'm Dr. Waleed El-Nahas, a pathology resident at Maadi Military Hospital, and today we are going to discuss an interesting case entitled by A Pretty Looking Spotted Tumor, supervised by Dr. Zahra El-Alfi, a researcher of pathology at National Research Center, Cairo, Egypt. Let's start by a case of a 13-year-old female presented with left adnexal mass which was discovered by radiology. She had no other clinical symptoms, previous history, or family history, so she underwent left oophorectomy and sent to us for examination. On gross examination, it showed a smooth outer surface and tan brown lobulated cut surface. Under the microscope, we found these features: roundness of variable-sized, simple and complex tubules, showing tall cells with pale cytoplasm and basally located nuclei. Some areas were sertoli-like, with solid tubules showing columnar cells with oval nuclei. We also found some solid areas of granulosa-like cells, with angulated grooved nuclei like shown here. After careful examination, we found a characteristic feature. Some of these tubules were encircling a hyaline material like basement membrane. We can see this material here inside the tubules, and also around them. It was shown here in different sections. This material was stained very nicely by periodic acid Schiff stain. Oh, I forgot to tell you, we found extensive areas of calcifications, like shown here in this slide. But luckily, all these calcified areas were also stained by periodic acid Schiff stain, like shown here and here. We decided to do some immunostains. We found that all these tubules were strongly stained by carnitine and also inhibin, but they were not stained by sulfur. After all these findings, we have come to the conclusion of six-cord tumor with annular tubules. So what's six-cord tumor with annular tubules? In 1950, Dr. Robert Scully was the first to describe this tumor as a distinctive entity for its unusual appearing features, which he discovered during his practice. If we look at the classification here of ovarian six-cord stroma tumors, we can see that six-cord tumor with annular tubules belongs to the pure six-cord tumor group. It's a rare tumor representing less than 1% of all six-cord stromal tumors. It has two types, a sporadic type and a syndromic type, which is associated with Busch-Jaeger syndrome. It can be seen at any age, but mainly at the 30s or 40s. It has a benign course, however, up to 20% of the sporadic type can show extra ovarian spread. Grossly, it presents as a unilateral mass, like in our case, with solid tan to yellow cut section. Cysts can be seen. The syndromic types can present bilaterally and multifocal, which often seen macroscopic, not by the naked eye. Microscopic features of this tumor are the same in both sporadic and syndromic. You will find variable-sized round nests of well-demarcated tubules encircling hyaline basement membrane-like material, which is stained by periodic acid Schiff stain. We can find these material also around the tubules. This tumor is characteristic of its arrangement as small concentric secondary ring-shaped acini. These acini are arranged peripherally around the circumference of a larger tubule. The cells are tall with basal located nuclei and pale cytoplasm, while the tubular areas often showing antipodal nuclear distribution, which is characteristic in this tumor. Calcification can be seen like in our case scenario. This tumor can take positive staining with inhibin and carnitine, like in our case, and also WT1, SF1, and FOXL2, but it doesn't stain with CD10 and epithelial membrane antigen. So if we look at the immunostains, we will see that most of these immunostains are also positive in both sertoli cell tumor and granulosa cell tumor, which they come first and second in the differential diagnosis of six-core tumor with annular tubules. So the question here, how to differentiate this tumor from sertoli and granulosa cell tumors? And the answer is the morphology. You won't find the characteristic annular tubules and their arrangement in these tumors. You also won't find the hyaline basement membrane material entrapped within the tubules and its affinity for periodic acid shift. So, as a take-home message, six-core tumor with annular tubules is a rare tumor you won't encounter in your daily practice. But keep it in mind if you found these characteristic features, and don't forget to order periodic acid shift, and don't also forget to examine the other organ. And finally, if you decide to report this tumor, you can inform the clinician to screen for Busch-Jaeger syndrome, as you can detect this serious syndrome from a benign tumor. Thank you.